Hello and welcome back to the third and final installment in AHRMM's series on supply chain waste reduction. I'm here again today with Tariq Kahn, the Materials Manager of Perioperative Services for Montefiore Medical Center. Today, we're discussing service line meetings for successful clinical integration and cost reduction.
Earlier, you started getting into working with the clinicians, and obviously our big focus is on clinical integration. What are your thoughts on the clinician involvement in healthcare supply chain?
Even with the different supplies, implants, things that are used on a patient, it's a clinician that signs off on it. It's a clinician who's talking to the integrity of what's being used, how it's being used, or even the existence of these things. So when you have physicians involved and really understanding as a stakeholder in your supply chain, I think that it only generates positive outcomes. I think it only can bring you success because they are the stakeholder. They are the end user. They are controlling the recipient that is going to now have these various items coming out of your supply chain. And what I've found, especially with right now in the organization I'm working for, we're having service line meetings and we're getting all of these various stakeholders. So you have the surgeon, you have the scrub, the material staff, the clinical leadership, myself, logistics, and sterile processing all in one room where we're looking at each other's processes. One of the biggest wastes that we have is extra processing and overproduction. Or for us, I guess we could discuss stockouts versus overstocking. Having a physician involved and understanding how these costs affect each other, and sometimes it's fiscal and sometimes it's surrounding the time that's needed to allocate resources, how it affects everything else that they're relying on. So if we have 10 different products that do exactly the same thing, we're not using one specific company, it increases our cost per case. You increase your cost per case, it can lead to patient satisfaction scores driving down because now the more that cost is for the patient, the less happy they are. I mean, ultimately, of course, when you're in need of clinical care, that is what you care about. But what happens after that is also very much important. So when your cost per case is significantly high and it kind of goes past what the insurance company will cover for that patient, and now they have this enormous bill to worry about, when they do receive that patient satisfaction survey, it will affect those things. And ultimately, we're here for the quality of care, but we want the people who are coming in to utilize the services that we're providing to leave happy and to leave unworried. So by having a clinician integrated into your supply chain, controlling all the different products that are out there, and also bringing in better ways to provide service to our patient is very important. And ultimately, as the end user, the more they understand of how the system comes together and how it gets to their hands, I don't think it hurts. I actually think that it's a measure of success. It's kind of what I do with my current team members now and my current staff. I try to bring them in on in-services. I try to bring in the vendors for these various companies that we're using to show them how the product is used. So the same way that relationship works as far as the non-clinical staff understanding how product is used, how it affects the patient outcome, how important it is, how literally not having something available can completely change the scope of a surgery, it's just as important for a clinician who's the user to understand how does that get to their room? How does that exist within the facility, and how does it impact their costs and their patient outcome? I try to enforce on my team and really motivate them. Yes, I don't expect you to be clinical, but I want you to understand how things are used. Because stockouts, these things will happen. Yeah. Back orders will happen. But by understanding what the product's being used for, it helps us to research and provide alternatives.
Thank you so much, Mr. Kahn. And, as always, for more education like this, please go to the AHRMM Knowledge Center.